Let's talk about different treatments for depression. How exactly is depression treated, let's say, in adolescence, since we're talking about teenagers? Amy?
So with adolescents, again, we're looking at different symptoms. So we might have to be on the lookout for something, and we might have to do a little bit more probing. And then I would also say that family therapy is really important with adolescents. So with adults, we may not necessarily include other family members, although I'm always for it, and I know Grace is too as a family therapist. But having the parents involved is going to be an extremely important portion of this, because if you think about it, adolescents are still very much dependent on their parents, for food, for housing, for everything. So I think Grace has more to add to that because she works a lot with adolescents.
So one of the things that we're looking at is in adolescence, you're going to see more of that anger and that irritability than you are in adults. You do see it in adults, but a lot of times we see it a lot in the adolescent. And so what we're looking at when we're talking about working with the family is helping them understand about the anger and that irritability and how it is depression. And so then we do offer cognitive behavioral therapy, which we do with adults. We'll talk a little bit more about that, but we're also offering play therapy. We can offer art therapy as well. And these are things that will help inspire the child and help them talk about their feelings in a different way. A lot of times with children and adolescents, they're not going to sit down and talk about, this is how I feel.
Right.
This is the stuff that's happening for me. They're not that verbal. Even if your child is very verbal and they're very smart, they're not always able to connect what they're thinking to what they're feeling to what's happening. And so that's what our job is, to help them connect that and then make the changes wherever they can.